We have a very distinctive and broad range of disciplines to address the challenges that the country and the region are facing.
The city itself aspires to be a world-class city of sport in all of its manifestations and with all of its influences.
Manchester has always had a reputation around public health. We're leaders in thinking through public health.
The university has decades worth of history of training and educating health and social care professionals to work in our health and social care sector. What we do really well as a university is combine our disciplinary expertise to address some of the challenges that we face.
The uniqueness comes from the willingness to engage in partnership. Very much we're into making alliances, so we've been very much involved in the devolution agenda. We've been trying to think about health and place as they've been trying to think about health and place. And with that willingness, whether we're training architects or health professions, comes, I think, a desire that solutions come from spaces and places and people. They don't come purely from labs.
Manchester Metropolitan University is building on many years of excellence in sport education and research to develop a new approach that blends these traditional areas of sports science and medicine with developing disciplines around sports, ethics, business and law. We're working in partnership with Manchester City Council and Manchester City Football Club to produce a new academic facility at the Etihad campus. It'll be home to 2 world-class research centres and nearly 3,000 students. That will have an influence on how sport is seen in the context of the economy and also about how sport integrates with improved health for this community and communities beyond.
What we do know about Manchester is in 20 years, over 1.1 million people will be above the age of 50. Now it's crucial that people live and age well in place, and that ageing starts with birth. So we want to find ways that we can connect with employment, with hospitals, with training providers in order to make that happen. Ageing is a public health agenda. We're all ageing, and it's important that we find positive ways of framing ageing.
One of the distinctive features of our education and training is our real emphasis on an asset-based approach. We emphasise health promotion, illness prevention. We work with people, families and communities to determine what works for them and embed that as an integral part of our education and training.
One of the strengths of our approach, I think, whether we're working with the movement clinic with physios or whether we're working on falls prevention, is we're very solution focused.